Hello, everybody. Welcome to Academics in Nutshell. Today, we will discuss some trivial questions. Apparently trivial, but these are often a cause of great distress to the parents. My 5-year-old has a white hair in the scalp. What might be the cause? Well, definitely, we will have to remember the rarer causes like tuberous sclerosis, piebaldism, Waardenburg syndrome. It may be an early sign of melanoma also, chloramphenicol toxicity, or even stress. Sometimes it may be due to vitiligo, vitamin B12 deficiency, or even hypothyroidism. But if there are no associated features, then we need not consider all these. We have to remember the usual causes, which is normal and often hereditary. So we can counsel the parents likewise. My 9-month-old has very sparse hair and has not grown much despite shaving his scalp 2 months ago. Well, the hair type and growth is hereditary. It cannot be altered. And hair may be sparse in first year, which is so common, which becomes more dense in toddlers. And one thing we have to remember that the number of hair follicles are constant. So shaving doesn't increase the number of hair follicles. My daughter has excess sweating of palms and soles and it causes great distress to her. What might be the cause and how to deal with it? Now, palmar hyperhidrosis is most often due to anxiety, stress, or nervousness. So we have to explain and counsel the family. But if it's very distressing, then to start with, one may try with antiperspirants or anticholinergics. If it's very severe and difficult to undertake the day-to-day activities, then we might need to do iontophoresis or even Botox treatment. My 2-year-old gets up crying in the middle of the night, cries for 15 to 20 minutes, and goes back to sleep. Well, this is a typical sleep terror in a 2-year-old. It is self-limiting, and often if we take history, we will find it's familial. Typically occurs in NREM sleep and often associated with autonomic activities, but it's short lasting. Management wise, we have to just comfort the child and should not try to wake the child up. In contrast, nightmare is seen in older children, usually 6 years and above, and it occurs in REM sleep. 3-year-old child bangs his legs in sleep at night. Well, this is periodic limb movement of sleep, PLMS. This is an involuntary leg and sometimes arm twitching or even jerky movements during sleep. Typically occurs frequently every 15 to 40 seconds and sometimes throughout the night also. The more severe form, which is the restless leg syndrome, may be associated, but it's a neurological sensory disorder and importantly, it's a sleep disorder. That's why it may lead to daytime sleepiness, affect mood, concentration, and school performance also. Mostly it is PLMS and need not do anything. And rarely it may be due to growth pain and also dream sequence. The child gets leg cramps and doctor said they are growing pains. What medicine should I use? Well, growing pain does not happen actually where growth is occurring or even during times of rapid growth. It's usually due to overuse of muscle and from other activities that causes the cramps. The cramps are typically throbbing pain in front of the thighs, the calves, or behind the knees. And here also counseling is most important. More to come with trivial questions. Thank you.